Part 2 of things that you should be considering when you want to go for an overseas hair transplant. Number 4, post-op care and complications. There are certain protocols to follow when it comes to cleanliness, hygiene, certain routine of medications immediately after your surgery, as well as how you should care for the grafted area. And different surgeons have different practices, but you need to make sure that this is well complied with. And if you're just flying in for the surgery and flying out, that might pose certain difficulties to sticking strictly to the post-op care. Complications may occur in any form of surgery, and your doctor should be communicating this to you at what rate certain complications might occur, and who is going to deal with the complications if you return to your point of origin after having the surgery done overseas. Point 5. Long-term care. A hair transplant simply does not stop hair loss. It is just a permanent relocation of hair follicles to areas that are bald. Now, your doctor should be communicating with you about preventative methods to prevent hair from thinning out slowly over time. And even with best efforts with medication, sometimes you will still continue to lose hair over certain areas. And the long-term follow-up is a close surveillance of areas that are not transplanted, which we call the transition zone, or other frontiers of hair loss such as the crown area, which were not addressed in the first transplant. And it's important that you have regular follow-ups with a doctor that's familiar with hair restoration surgery in the local context.